Marty. I am the Director of Sales and Business Development here at Amazing Charts. And today we're going to be discussing our new revenue cycle management services, which is basically going to be a billing service provided for you on behalf of a third-party partner of Amazing Charts. To give you some history behind the program, we have worked in the past with several third-party billing partners and allowed them to compete for the best business model that they could put forth for our clients that were looking for outsourcing their billing. Over that time, we had some that had some issues and some that rose to the top. The one that we had zero issues with and actually quite a few letters of recommendation and thank you came our way was PGM Billing, who's going to be handling our revenue cycle management. And rather than have competing entities working for your business, we felt that it would be best if we just chose one solid partner to pursue this endeavor as a team with us. So hence we have decided and moved forward. We've already started providing these services for several of our clients. And today we're going to cover some of the high points of what goes into revenue cycle management. So as I said, we'll be going over an overview, and then I'm going to be passing it along to Greg Perini. Greg Perini is the head of sales for PGM Billing. He's an expert on the billing side. I'm more of the software side on our clinical side. So he's going to go over the process and technology. At the end, we have several case studies attached to the slideshow, which are basically success stories of some of the clients that have used the billing services. Rather than read those slides to you in detail, what we'll do is we'll pause on those slides so you can look at them, but this entire presentation will be recorded and sent to each of you to watch again at your leisure. So what goes into RCM? With RCM, you avoid complex billing rules, follow-up, and cash flow interruptions, and you let the Amazing Charts RCM team do the work for you. Amazing Charts Revenue Cycle Management increases your productivity, your revenue, and most importantly, the time that you get to spend with your patients. You take the work of billing off of your hands and assign it to them. As far as some of the stats that you'll be looking for improvement with, you'll have real-time transfer of billing. There's an interface, an HL7 interface that connects Amazing Charts with the billing platform. So your coding and information will be sent directly through to them, which will be less effort and less work for your staff that you're doing today. One of the things that they boast about is that 95% of the claims that they submit are paid on the first submission. And anybody that's worked with a third-party biller will realize that is a high number. I think that industry norm is somewhere around 80 to 85%. So clearly they're above the rest of the field. Another piece is that you will actually see an increase in your collections. On average, it's about 20% for each practice that PGM takes over billing on. And the reason that you're going to see that increase is because there's more work done on follow-up. They're going to get more of it paid the first time, but that 5% that might not get paid, they're going to chase that down and try and get every penny of it in for your practice. So in a service where you might be getting $80 of every $100 that you are billing out, with this you'd be looking more like $95 to $100 of everything that you're billing out is coming in. So it's a big increase. Like I said, they have timely follow-up. They'll chase down denials. They'll chase down appeals. They'll make sure that coding is correct. And then, of course, there's immediate payment posting as well. And then I will pass it along to Greg and let Greg explain to you guys a little bit about this and get into some of the details of the revenue cycle management.
Okay, thank you, Adam. I appreciate everybody getting on the call today. Just the fact that you're taking time out of your busy day to attend this webinar proves to us that you understand how important cash flow and reimbursement is. It's the lifeblood of your practice, and again, we appreciate your time and interest in joining us on today's webinar. Really quickly and sort of high level, just an understanding of what revenue cycle management is, and the Healthcare Financing Management Association defines revenue as basically all of the administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue. And basically, again, that is what we call the entire life cycle of a patient account, from the encounter to a full adjudication of that claim. The process of revenue cycle management includes reporting and acting on financial path of patients from scheduling through payment. So again, it just is the overall flow of all of the work that goes into everything from the minute the doctor encounters that patient to once that patient is closed out as completely paid. Why AC RCM as opposed to a different billing solution? And I think one of the big reasons that we look at this is really a high degree of personalized experience. For the first thing that happens when you sign on with AC RCM is you are assigned a dedicated account representative. That person acts as a single point of reference who is uniquely familiar with your practice, and a person who's going to represent you professionally with your patients as well as your payers. We go through a comprehensive new account setup and training implementation to make sure that you fully understand the software and what we're going to provide for you, but more importantly, we want to understand your philosophy for your practice. What are the things that are important to you? How is your practice set up? How do your workflows operate? We're not here to change your practice. We're here to enhance it and obviously make recommendations for ways to improve cash, but really to sort of become part of your practice with a highly customizable solution for you. The other thing that we're going to do is periodic account reviews with yourself, your management team, your practice manager, whoever else you need to be involved in that. You know, the number one complaint that I hear when I talk to practices around the country is visibility and transparency. And I've said this on a number of conference calls that I've been on representing Amazing Charts. And by having periodic reviews to go over your numbers, to go over what we're seeing in terms of your revenue cycle management, in particular your denials, there's going to be a high degree of transparency through the software where you'll be able to see that data, but we're going to take it a step further and consult with you on a periodic basis to make sure that when we do identify trends regarding, you know, really anything, payment issues, clawbacks, denials, we want to make sure that you at the front end of the practice are aware of them so that we can change them together and make sure we're getting you guys fully paid, you know, for the services you provide. And that transparency is provided through a cloud-based software that we're going to show you in a minute, but also through a direct access to your account representative who's based in the U.S. So you have complete access to that individual. The issue of pricing comes up all the time when we talk about revenue cycle management. Basically, the way we've structured this program depends a lot on a customizable solution for each individual practice. Standard pricing is about 6.5% of collections, but there are many variables that we look at in a practice to determine if that's appropriate. Sometimes it's higher, sometimes it's lower. So we try to create a solution and a pricing model that works for your practice. So, you know, what I would say is that in terms of pricing, that's the time where you really want to have a discussion with the revenue cycle management sales team to get an understanding of your practice, to look at what's going on in your practice and how we might be able to put a solution together and put a proposal out in front of you that makes sense for your practice. The other big reason why AC RCM is a great solution for your practice is the fact that the billing software is fully integrated with the Amazing Charts EHR. So the days of having to close your practice at the end of the day, print off your super bills or run an AC preferred report, gather all of that documentation, put it in the fax machine, send it over to your billing company, or even worse, having to go to a clearinghouse or a practice management software that's not interfaced with your EHR and having to actually rekey all of that data into a billing system. That's just a tremendous waste of resources at the practice. There are far better things that that you and your office staff can be doing to help manage patients and workflows and enhancing that patient encounter for your patients. So we eliminate all of that effort, and we have created, as Adam mentioned, an HL7 interface which links the EHR and the revenue cycle management software together so that the data transfers seamlessly over to the billing software. And we have the ability to set some parameters on how that happens. Typically, as you sign off on patient encounters and complete your chart notes and move to the next patient, that data moves to the billing side. We have the ability to customize that. We have physicians periodically who maybe see their patients and have to go back and update notes, or they're going to order additional tests and the nurse is going to have to complete that chart or add something to it. So you may not want it to go over to the billing side immediately. We have the ability to customize that as well, and put delays in it, or craft a time frame that works for you so that, again, you can manage your workflows. Again, our objective is to not fit you into the software, but to fit the software to your practice. The next important thing I think to think about when thinking about revenue cycle management for your practice is the idea of cloud-based reporting. And again, we talk about transparency. The AC RCM platform is going to provide full transparency for you and your practice and your staff, and that data can be accessed on your desktop, in your office, on a handheld, at home. It is a real-time, cloud-based systems, and so that as we're updating patient accounts, patient ledgers, payments, etc., all of that information is going to flow real time. So you're going to have up-to-date analytics and reporting at your fingertips at all time. And as Adam mentioned, AC RCM is a collaboration between Amazing Charts and Physician Group Management. We've been working with Amazing Charts for a number of years. We've actually been in business since 1981. We've been providing physicians a full host of products since that time. And the goal is always to help simplify and manage the workflow, allowing you, again, to focus on your patient, allowing your staff to focus on the intake process and the insurance verification process and the things that you need to do to get that patient in and be seen, and allow us to manage the back office solution, the billing, the collections, the patient statements, etc. As you can see, we manage about 500 physicians in about 38 states. We manage currently about 30 different specialties, and over the years we've managed approximately 300 Amazing Charts practices. So we've worked very well with Amazing Charts over the years, and it's been a phenomenal relationship for us, and we're happy to be part of this endeavor going forward. And we've managed about $400 million in receivables since the launch of our programs together. So it's a pretty significant track record, one that we're very proud of, and we hope we can get the opportunity to work with you and your practice and show you the results of what we can do for you. Again, we mentioned a little bit early, dedicated account representatives. I think that's pretty important. So I want to kind of take a minute to explain how that works. When you work with Amazing Charts Revenue Cycle Management, you will get assigned to a dedicated account representative. That person is always backed up by a supervisor. So your billing never sleeps, your billing never goes on vacation, and your billing never gets sick. We will manage your billing and collections even when your rep is not available, because we have resources dedicated to it. We've got redundancies built in, so we have people who step in and continue to manage that. Under your account representative, there's a team of people who continually work the process for you. We talked about workflow, and the goal is to never let the workflow stop. So we have people who manage claims processing, we have people who manage payment posting, and we have people who manage accounts receivable follow-up, work denials, etc. So understand that it's not just your dedicated account representative who is going to be managing your account. That's the person that is going to be the liaison between the billing office and your practice, but there's a number of people and additional resources underneath that account manager who are going to help maintain your cash flow, work on your workflows, and make sure your billing gets out clean and paid. So I want to talk a little bit about process and technology, and this is what a typical RCM workflow looks like. So the first thing we would do when a practice signs on with us is to do a practice analysis, and our coders will take a look at your billing, your collections, your super bills, look at your insurance masters, look at your AR to make sure that you're coding properly, getting reimbursed appropriately, etc. Once that evaluation is done, we will give you the findings of that evaluation and obviously talk about areas for improvement and how we would craft or recommend crafting workflows for optimal reimbursement. On a day-to-day basis, charges and demographics are seamlessly imported into the AC RCM through that HL7 feed, which again requires no data migration, no manual entry. There are no changes to you as the physician, as the medical provider at the front end. You're going to just continue to see your patients, document your encounters, and once those encounters are signed off on, they go to the billing file through that HL7 interface for us to begin to manage. The first thing we'll do is a claim review. We will upload your balances and scrub them for errors prior to submission. Once we are assured that they're clean, we'll go ahead and submit them. They're transmitted to the various payers through our clearinghouse. We will manage for insurances that don't accept electronic claims, or for claims that may require additional documentation, such as workers' comp, MVA, those types of claims where often large amounts of medical documentation has to go along with the claim. We will manage a paper claim processing process for you, so that's included. We will also manage all of the insurance payment posting. We will receive either ERA, which is electronic remittance, or EOB. Those will be posted into the system by your representative or your payment poster. Often EOBs will come to the practice. We will set up a mechanism through a share file for you to be able to transmit patient-sensitive information to us in a HIPAA-secure manner so that we can post anything that comes to the office in a timely manner. And the other thing we will do during setup is we will analyze who is sending you EOBs. There's always going to be smaller payers that don't have the ability to do ERA, or where there may be one-offs and you don't see a lot of patients under that payer. But for your larger payers where you've got significant volumes, we will go ahead through the EDI process to try to get you enrolled in ERA. Our goal with the program is to create efficiency both in your practice but also on the billing side. So to that point, what we want to do is maximize as much electronic data transmission as possible. So the more we can move through the system, the better. That creates efficiency for everyone. So we will sign you up for ERAs. We do not change EFTs. We do not escrow funds. Monies are always deposited in your account under your name, under your tax ID number. Patient payments, we again manage the patient payment portion of your claims. Typically they send payments directly to the practice, but we have had clients who send them directly to us. We can do deposits on your behalf if you are a practice that has maybe a national or large regional bank where I have a local branch. Otherwise, we have them sent to you. You guys deposit them, and we have through the software we've got the ability to for you to put the patient payments into a ledger or a spreadsheet so that we can then post them to the patient's account in a timely manner. Claim tracking. Payments are posted and run through our payer-specific rule software, which is designed to really detect any deficiencies in claims, but also to track unpaid claims. Unpaid claims are audited and followed up on, and based on the result of that follow-up determines what action needs to be done. It could be a request for medical records. It could be a reprocess to a different carrier if we had the wrong insurance the first time. It could be a number of, it could be a denial that needs to be managed or appealed. So there's a number of different things that we'll do in terms of the denial management follow-up process. But our system will give us alerts so that your account representative can make sure that we're on top of any accounts that are aging and managing them to make sure that they're not falling into, the aging buckets and we're losing anything that we should be chasing. And then the last piece of it is patient billing. So we customize statements and create a billing platform or a billing profile, I should say, based on input from the physicians and the office to make sure that we're aggressively going after your patient balances. But there's a lot of input at the physician level to determine how aggressive you want us to be. We do work with, if you have a collection agency, we have the ability to work with your collection agency. We are not a collection agency. Our patient billing policy basically involves a combination of patient statements, patient phone calls, and alert letters to try to prompt the patients to pay their bills in a timely manner. For practices for clients who have patient balances at the end of the month, after we've exhausted our efforts, what we will do is we will go ahead and send you a list that you can actually review at the practice level to determine whether you want to write it off, send it to a hardcore collection agency, or some other method. A lot of times we have the ability to capture some of that additional revenue because we don't necessarily know that a patient may be coming back in, for a well visit in 3 weeks or a follow-up in 3 weeks. And that may be a perfect opportunity for you to collect that where they've been unresponsive to our requests. So we want to keep you in the loop to make sure that we maximize as much of the collections as possible. And that gives you an opportunity to collect the next time the patient comes in, and we don't have to write that off to bad debt. What I want to do is do a quick demo of the software at this point. Just a real sort of high level. I will say that if after this webinar, if anybody is interested in a full demo, you can actually reach out to Adam Lombardi. His cell number is his office number, I should say, is 401-336-3364, and we'll put up all the information at the end of the webinar as well. But he will be able to get his team to set up demos for you. And we can obviously go into a more in-depth look at the software, but I wanted to give everybody a little bit of a demo of the software just so they have a chance to see it. The software was actually developed with a couple of things in mind, and really it was the practice in mind. Most billing software is designed for billers, but we wanted to make sure that we put forth a software product that had the physician in mind, and to that point, what we decided to do was create an initial dashboard. So whenever somebody at the office dials into or logs into the software, they're going to get a dashboard, which is going to be the most current, up-to-date information for the practice. And this has a high degree of flexibility, so you have the ability to pick whatever dashboards you want. If you don't want to see patient balances, you can actually just click here and eliminate it, and then it'll come off the dashboard. If you want to add it, you just add it back. So you have a high degree of flexibility to be able to look at what you want to look at. But some of the things that we measure, obviously, is your days in AR. We want to make sure that we're managing your reimbursement in a timely manner. Charges to collections. That's often a big question when I speak to physicians. What is your percent to collections? Well, keep in mind that charges is your list charge is typically something higher than the insurance allowable. So there are always contractual allowances factored into collection rate. But this gives you a quick look at a monthly overview of charges versus collections. One of the things that I think really is important too in the software is the denials. A lot of practices want to know where their denials are. And you can see this will give you a snapshot over the last 6 months of your denial codes. So here 2.4% of your denials are here. This one, charges exceed fee schedule. These 45s are contractual. Here's patient cannot be identified. So this hover over technology allows you to look at the denial reason, and these are the things that the revenue cycle management team is going to look at to understand why you're getting denials. For example, if we're seeing denials with no authorization, here the payment adjusted because the payer deems the information does not support the frequency, whatever the case may be, this is information that we're going to be sharing with you and you'll have access to on a regular basis to be able to improve your practice performance. The productivity matrix, again, is a 6-month snapshot of charges, collections, average reimbursement per encounter, etc., and your collection ratios. And then the other thing here, again, is a CPT analysis. I often speak to physicians who really want to know what are my high value, high frequency CPT codes. And you can see if you look here on an 87798 as a top volume and an 87798 as a top reimbursement, you would anticipate that those two would correlate. But they don't always do that. So that's an indicator or something that you can look at the practice level to understand if those numbers don't align, why I'm doing a certain procedure as a high volume procedure but not getting reimbursed at a high rate for that, which is obviously an opportunity for you to go back and look at those codes, maybe go back to the payer and get an understanding of why you're not seeing a fair reimbursement for that information, or for that code rather. And then the last section is actually a patient notes section, which actually gives us the ability to transmit notes back and forth between the practice and the billing office. So obviously there's a tremendous amount of communication with the practice and the account representative. Email, phone call, however you prefer to manage communication. But there are certainly things that are emergent and need to be discussed right away, and there are certain other things that are not of an emergency nature or emergent nature that we can sort of park out there and you can address. So a lot of times if, let's say we have a change of payer, we identify that a patient's policy termed, we may put a note in here saying, Mary Smith's policy termed, her new policy is Aetna. When your office manager or office person logs into the system in the morning, they will see that and they'll be able to go in and update the patient's file in the EHR. The next section is billing, and here's where I talked about the copays a little bit. What we've done is we've provided the ability for you to go in. So any payments that are collected at the office, you can actually go in and type in a patient's name. Here's Betty Berkeley. We collected a $20 copay. It was a credit card for date of service 11/3/16. And then you save that. And what that does is it puts that payment here so that we can go ahead and when we produce that charge on the export and we submit that claim to the insurance carrier, we can immediately go back and post that $20 to the patient's account so that the ledger reflects accurately that the patient's been paid. And then the last section is reporting. And we've taken a little bit of a different approach with reporting. In most billing practice or billing or practice management software, there are typically canned reports, and in some practice management software, there's hundreds of reports. What we've done is we've streamlined the reporting function to make it a little easier for the end user. And if you look at a typical payment report, a payment report may have, obviously it's going to have the patient name, the insurance company, the amount, the date, the code, etc. So rather than having that as 5 different reports, we have payment reports which allow us to sort by any of those fields. Because on all of those reports, the data is the same. It's just a matter of how it's sorted. So we allow you to do that sorting on screen and then export that data as either a CSV file, an Excel file, or a PDF file. Again, giving you the ability to run this analysis, look at this, try to understand where your payments are coming from, where you're doing well, what insurances you're not doing well on, etc., and give you the analytics to really manage your practice. And that's again the goal, is to give you the insight and the analytics and the ability to manage your practice and make decisions based off of meaningful data that you may not have with a current solution where you don't have transparency. So again, if you're interested in a demo of the software, please feel free to reach out to the Amazing Charts sales team. We're more than happy to set that up. It takes a typical demo takes anywhere from about 40 minutes to an hour, depending on questions and answers and specifics to your practice. So, but we're more than happy to do that. We're very confident in the ability and the software to provide the information that you need and to manage your billing and revenue cycle. So we'd love an opportunity to show you a more in-depth view of the software. So Adam, do you want to jump in and talk about this slide a little bit?
Sure, I'll hop back in, and thanks a lot, Greg. I appreciate you taking the time for us to go through all that. And as I get into this slide, I also want to bring up another point about the integration, as well as the billing and the software being integrated. I want to make sure everybody understands that the people behind the scenes are integrated as well with this, because it is a team effort. Greg and I are on the phone regularly day to day, and yesterday their COO was actually here in our office and spent the entire day meeting with John Squire, our president, myself, and also my department, going over some of the things that might improve the services and the experience for our clients, and always looking at what else is out there on the market to try and make sure that we're staying one step ahead of the game. So as we talk about billing, there's several different options for billing. We recently had sent out a mailer that many of you might have received with my name and number on it. And for our basic billing starting, what we look at is using Amazing Charts on the clinical side along with an interface, and that interface can connect to any third-party billing software that your office is already using or may want to take on. What you're going to notice if you are going with that type of a solution is that you will have some double entry, because if something changes in one system, you're also going to have to reflect that change in the other. For example, if a patient moves and changes his address, you would need to go into both your billing software and the Amazing Charts clinical side and make that change. Some people don't mind that double entry because they're comfortable with the billing software that they are using in their office. The next step up from that would be our Amazing Charts Practice Management, where you eliminate most of that double entry because it is a fully integrated product. So changes that you make on the Amazing Charts side automatically will appear on the Amazing Charts Practice Management side. This software would give you an electronic connection through the clearinghouse that you could actually see a patient, go through your encounter, create your codes. Codes appear in the practice management. You can submit those claims through the clearinghouse and receive electronic payment back from your insurance payers. Now, both of those using an interface to a third-party practice management or using our practice management are both software programs. Those are not services. So what that's going to require is that you actually have somebody on staff in your office that understands billing completely and can do those things. If you're getting somebody who understands it a little bit, you're probably going to be in that category of people that are seeing 70 to 80% of your claims being paid. And if you're losing 1/5 of your money, that's a big hit on your cash flow, which is going to cover payroll and overhead. So make sure if you're going to take on an endeavor like a practice management, that you do have staff members that can complete the billing for you efficiently and not just the simple claims that are going to be paid on the first submission. If you are without that, that's when you should look at a billing service like the revenue cycle management. And then all the way to the right, you'll see Amazing Charts Inlight EHR. Common trend in today's industry, because people are getting fed up with dealing with the insurance companies, is moving into a concierge or a direct primary care practice where they don't take any insurance payments. They're paid cash only. And Inlight EHR is a second electronic health record system that we've developed here, and it specifically meets the needs of those direct primary care and cash pay businesses where they can set up membership management. Some of those doctors, rather than charging per visit, charge a patient a monthly fee to be their patient, and regardless of if they come in for a visit or not, they will get billed that month. This software gives you the ability to do that. It has a little bit of a different flow than Amazing Charts. Rather than following the typical SOAP note, it's based on a problem-oriented approach. So it starts off looking a little different than what you are used to using, but if you are considering moving into one of those types of fields in the concierge or direct primary care world, this product is definitely the most valuable one on the market for you to meet your needs. If you do have any questions and want to see demonstrations of any of the Amazing Charts products listed here, you can reach out to my sales team, which is option 2 at our toll-free number. Our toll-free number is 866-382-5932. And by all means, anybody that's here, feel free to reach out to me if you have any questions or need any help with making a decision on what's the best fit for you. As Greg mentioned, you can reach me directly by phone, or if you prefer to use email, you can contact me at alombardi, Lombardi, at amazingcharts.com. And all of my emails, all of my voicemails get forwarded to my cell phone. So regardless of where I am, if I'm on the road at a conference or if I'm at home having dinner, I'm going to get that message from you, and you will hear back from me. Okay, and then the next slide, Greg. So here's the case studies that I was talking about. I'm not going to spend a lot of time in reading these, but like I said, these will be sent to you with a copy of the recording of today's webinar. Basically, it's some personal experiences of practices that have used the billing services from PGM along with the electronic health record system services from Amazing Charts. So it'll give you some view into what other people, your peers, are actually feeling about the service rather than hearing it directly from us.
Adam, let me just jump in there as well, because I know a lot of times physicians want to speak to other physicians in terms of references. So if you've got questions, if this is something that you think you're interested in but you'd like to speak to another doctor who's used the service and get a more personal reference, we can absolutely do that. So please, again, if you're interested in revenue cycle management, please reach out to Adam's team. We'll get you started with a demo. You can look at the software, and then we're more than happy to get you a reference or two to see if it's the right solution for you. You know what, Adam? You want to address a couple of questions, or somebody
Sure.
Somebody actually put a question out there. And how is follow-up handled? So basically, I mentioned earlier that not only do you have an account manager who is your single point of contact or your reference point at the billing office. Again, there are a number of support people that work your account. So that's important to understand. It's not just one person. It's a team of people at your disposal at managing your revenue cycle. The way AR follow-up is done is that once a month your AR person will actually run your aged AR, and they will status all of your claims that are outstanding by either using the insurance portal or physically calling the insurance company or using some other third-party software that's available out on the market to find out, has the claim been paid? If so, at what rate? When will the check be in, etc. That information is all logged into the patient notes section, so that if you ever have a question as to why there's a patient balance on a particular patient, again, we talked about transparency. You have full access to drill down and pull up that patient and review those notes, if that's the level of involvement that you want, or the office manager needs to look at a certain issue. So you can actually go in, read those notes, and get a description of exactly why that claim hasn't been paid. Also, one of the things that we will do is we don't only look for denials and unpaid claims, but we also manage what we call short paid claims. And as long as we have access to your fee schedules, we will compare the actual payment against your fee schedule to determine if it was underpaid or paid accurately. If it has been underpaid, we will then challenge it with the insurance company to seek additional reimbursement on that claim. So again, our staff's going to manage all of that, and anytime there are trends found in that, if we find that one insurance is continually short paying, we'll obviously alert you to that. But that, again, through the software, that's something that you're going to recognize and see as well. But that's information that we share with our clients as we meet with them regularly, so they have an understanding of what we're seeing on the revenue side and how it may be impacting their reimbursements. So somebody else asked about availability of staff. So again, you have a direct line to your account manager during business hours. Our business hours are 7 a.m. to 8 p.m. Eastern Standard Time, and we stagger our shifts to accommodate all time zones. So yes, you will have access to your account manager or their backup, again, if they're on vacation, out sick, whatever. So you will be able to get through to the billing office, as will your customers. Your patients will be able to get through to the billing office as well, based on whatever time zone they're in. So that's not a problem. Another question came up about credentialing. So credentialing is not covered under the Amazing Charts Revenue Cycle Management fee. However, we do provide credentialing for our RCM customers. So that could be anything from adding new providers to your practice. That could be credentialing and contracting with new payers. That could be managing revalidations or something like that, or changes to the practice, address changes, whatever. We manage all of that, and I would just say that if that's something that you're interested in, again, you could reach out to the sales team at the number that Adam provided, and we can quote you based on whatever your credentialing needs are. We can work up a quote for you. I think that's all I have, Adam. I don't know if you've got anything else on your side.
No, I don't have anything else to add, but if any of you do come up with any ideas or questions, that, of course, all of us have afterthoughts as soon as the minute passes. So in that case, if you do have any questions, feel free to reach out directly to me. I can connect you either with one of my account managers who's well-versed on the topic, or I could connect you directly with Greg if you wanted to see a one-on-one in-depth demonstration, as well as have some of your questions answered. Okay, great. Well, guys, I appreciate everybody giving us the time, and like I said, you will be receiving an email with a copy of the recording of today's webinar, and we look forward to speaking with you after this and trying to help you out assessing what is going to be the best solution for your practice and your billing needs.
Thank you, everybody.